Thank you. So after sitting through 6 resource presentations, we get to take a look at a biotech presentation. So hopefully we'll can jump over the disclaimer. Quick overview of the company. It's had an interesting run over the last 2 years, run up from I joined in 2019 at the time when the share price was below 5 cents. It's run up to about $4, it sat at $3 for a while and then got smashed along with all the other biotechs over the last 6 months or so. Great opportunity to get into the biotech space if you're not in that. We only have 160 million shares on issue, not too many options. We have around almost 10,000 shareholders, 9,500. We have a share price, market cap around $250 million. We have, which is very important for a biotech, compared to resource companies which you can run, on a smell of an oily rag. Biotech is very expensive. We've got $35.7 million of cash in the bank, and we have an enterprise value of around $230 million. I'm the largest shareholder of the company. I came in as an investor. I put my own money into the company, and along with Dr. John Cullity, our chairman, and Merchant Opportunity Fund, there's it's a real skin in the game by management. So some of you may have heard of Race Oncology. It's been around since 2016. From 2016 until 2019, it had a very different strategy. Same drug, Xantrine, but it was directed at trying to as an alternative chemotherapeutic for acute myeloid leukemia, which some of you may have heard of. It's a really nasty leukemia. Left untreated, from diagnosis to death, is 9 weeks. That's how bad of a nasty cancer this is. Standard treatment for this is chemotherapy, but the chemotherapy they give you will be very damaging to your heart. It's actually one of the reasons why Xantrine was brought back. It was originally discovered as being an alternative anthracycline that was less damaging to the heart. So after I joined, there was a new team, new opportunity, new strategy put together to really take advantage of some major discoveries that have been made in the space. So it's been known for a long time. Obviously, this drug's been around since the 1980s. They didn't know why it was protective to the heart. I suspected that there was much more to it. Turned out that there was a paper published in the middle of 2020 in Cancer Cell by a group out of the City of Hope in Los Angeles, which identified pretty much how Xantrine worked. And it inhibits this enzyme called FTO, and I'd love to go into a great deal of discussion about this, and come and talk to me at the booth afterwards if you wish. But this FTO protein is involved in a wide range of cancers. In fact, every cancer that anyone's looked at, FTO is involved in a subset of those. So far I think we're up to 29 different cancer types, and every one of those has had FTO involved in it. It doesn't mean every cancer, but at least a subset, somewhere between 5 and 90%. And the other thing that came more recently, the end of 2021, was we actually found out that the drug not only didn't have damage to the heart like the other chemotherapeutic agents, it actually could protect against damage to the heart. And this is really important because it means you can combine the drug with the normal chemotherapeutic agents, which the oncologists, the doctors that treat cancer are familiar with, use widely, know how they work, and prevent the thing that's most dangerous. Obviously, it can work with many different cancers. The area this is in, turns out FTO is in an area of RNA epigenomics. It's a very complicated area. It's a really hot area in the biotech pharmaceutical space. All these companies here that have done deals with large pharma, these are all preclinical companies. They haven't got any yet to have treated a single patient, and yet they're doing billion-dollar deals, US dollar deals in this space. And that's because the space is such a hot area. We happen to be the only company in the entire world that has a drug in this space in the clinic actually treating patients right now. It's really an amazing opportunity for an Australian company to be in that situation. We don't often get that opportunity here in Australia. We have a very extensive pipeline of activities built around what we call the three-pillar strategy, basically around the use of the drug as it's historically was used in a better formulation, which gives IP and broadens the use of the drug, and also looking at beyond. So this is a part of a family of different proteins that are involved in driving cancer, and there are lots of opportunities there. We happen to be a leader in this space, so we're trying to take advantage of that. And so I'll take you through some of the, I can't go through obviously all those things on that list, because we've only got 15 minutes. I could probably sit here all day talking to you about them. So I'll talk to you about a couple of recent pieces of news that have come in the last month, and including one that's come out today. So for those of you who want to know more about the story, we had an ASX release today with a lot of interesting data. So we happen to have a what's now a phase 2 clinical trial running in Israel at the moment, using our drug to treat acute myeloid leukemia. We had run a small phase 2 back in 2020, which had shown a really impressive 40% rescue of response rate in patients that have been very heavily treated. The problem with cancer is, as many of you might know, as you get more and more treatment, each treatment that you get is less and less likely to work. It's just the nature of the way cancer treatment works. It might work 50% of the time first for patients that have never experienced any cancer treatment before, but if after they've got down to the 5th or 6th line of treatment, the chance of that working gets pretty close to zero. So we had patients that had failed everything else, all the existing treatments on the market, all the experimental treatments that were known. They finally got to our drug and they worked 40% of the time. So we decided to follow on from that with a new trial in Israel. The investigator there was very keen to run a new trial, and this is using a combination with another couple of other drugs that are used to treat leukemia. And he had to go through, obviously, when you combine drugs together for the first time in humans, you have to work out what the optimal dose is. This is called the phase 1. That completed in May of this year. 6 of the patients, 3 of them were bridged to a stem cell transplant, which is that's what you really want to get out of. If you have leukemia, if you can get a stem cell transplant, you've got a reasonable chance of being cured. If you can't get to a stem cell transplant, you basically can only delay the treatment. So really quite an impressive. These patients in this phase 1 stage were even more heavily treated than the patients in the first trial, average of 4.5 previous lines of treatment, some of them up to 8 previous lines of treatment. It's just unheard of until a couple of years ago to even get that far. There's been a lot of advances going on in the field. So it's now moved on to the phase 2 stage, which is where we determine efficacy, how well this combination will work. We're really looking forward to that over the next 20 to 30 months. It'll probably be less than that before shareholders will get an idea of how the trial's going, because it's an open label study, which means it's not double blinded where you don't know the results of the trial. And that can be very frustrating as an investor. You might be waiting years for a trial results to come in. This is open label, so we get to actually, as each patient, the results come in, and we'll be releasing that data in batches as they come along. And then released today, there was a hint that FTO from some of the published literature is involved in immunotherapy or causing resistance to immunotherapy drugs. So many of you will have heard the amazing revolution that's occurred over the last 10 years in immunotherapy, where you have patients with, say, melanoma, but also other diseases like lung disease and breast cancer, where you can give a immunotherapeutic drug like Keytruda. You can be weeks from dying and suddenly cured. Really amazing result. The problem is it only works in a small percentage of patients. And if you're one of the lucky ones, that's fantastic. And if you're one of the ones that don't respond, basically it's a very serious outcome from that. And so we went in a program, there was discoveries from other groups that had shown that FTO was important and could be, if you inhibited FTO, which means you block FTO, which is what our drug does, you could overcome this resistance. So we went back in, they did that work using genetic tools, which aren't translatable into the clinic. They're just useful in the lab, but they're not really very useful for treating a patient. And we saw, could we do the same thing using our drug, which is translatable into the clinic in mice? And we chose a really difficult mouse model. This is one that the immunotherapy drugs do nothing to it. You inject the immunotherapy drugs into the mouse with this cancer, and the cancer just grows as exactly the same as though you hadn't touched it at all. And what we found is that we were actually able to overcome that resistance. We were able to better target the tumours. We were able to activate the immune system in the right way. So it's the drugs working in multiple different ways. It both directly targets the cancer, killing the cancer. It activates the immune system, and on top of it, it down-regulates the genes that allow the cancer to hide from the immune system, which is all those three together, all work together to create a really amazing environment to actually get this thing to work. This is quite a breakthrough, I think, in this particular area, and really offers a lot of hope, not only for melanoma. Melanoma is just a test system, I guess. It's obviously, if you've got melanoma, it's really serious, but the immunotherapy drugs are used across all different cancers these days. Made a huge difference. But they still need a lot of further work required to get them to work for all patients. So there's lots more about that in the release that was put out today. It's about 12 pages long, so full of science. Cancer cardiac protection. So this was a discovery I mentioned at the beginning that was made at the end of last year. And overcoming, this has been kind of a bit of a holy grail for cancer treatment, is what can you do about the damage that the best drugs that work for treating cancer, chemotherapy, what can you do to prevent the thing that actually prevents you from using those drugs, which is cardiotoxicity, which is basically just damage to the heart. And so if you take breast cancer, for example, more women that get breast cancer will die of heart disease than they will die of breast cancer. And the reason why that happens is because the treatment for the breast cancer has become so much better over the last, say, 15, 20 years, that their patients are living long enough to actually get the serious side effects from these drugs. So it's not a great win to move from cancer to heart failure, because heart failure is really not a great thing to have. So in collaboration with a world-leading group up at Newcastle University, at Newcastle in Sydney, not the Newcastle in the UK, we worked with them to actually see, how does our drug Xantrine work to prevent this? And what we found is that if you add Xantrine to doxorubicin, which is the most commonly used drug in this class, you could actually capture and undo the damage and allow the heart cells to survive. Really quite an amazing discovery. We've got ongoing animal tests to show whether this will actually still work. This work was done in what's called tissue culture, just to see whether it'll actually apply in animals. And if that's positive, we'll be able to very rapidly move into a phase 2 clinical trial in breast cancer patients to try and prove this out. This opens up a multi-billion-dollar market separate from the whole FTO area. It's a real blockbuster opportunity, and it's one that's very easily translated and very rapid to translate, because these drugs are very widely used. For example, doxorubicin, 20 million doses of doxorubicin are used around the world. So there's a lot of, if everyone uses our drug in combination with doxorubicin, it makes a big difference. Huge amount of unmet need, and something that could make a real difference to patients, because there's no point being cured from cancer if you then die of another side effect of that treatment. A lot of news flow. We've been releasing a lot of activity over the years. We're not one of these biotechs where you don't hear anything for years at a time, wondering what's going on. You just have to be incredibly patient, and you wonder whether you're going to actually live long enough to actually see a result. We release constantly news flow. There's been a lot just in this quarter. We've got a lot of amazing activities coming up, both preclinical, which is in animals and cells, and also clinical trials. We've got another clinical trial starting up here in Australia very shortly. Lots and lots to look forward to. Really exciting opportunity. I have to say I'm personally amazed that I got lucky enough to get involved in this company, and it's turned out really well. So come and see if you want to know more. We'll be at the booth for the rest of the day. Thank you.
Daniel, thank you so much for that.